There are a few actions that we need to put in place. One of them is to ensure that we have adequate numbers of health workers who are well motivated and who can be retained in the positions they occupy. To motivate health workers, we are talking about several things. One of them, of course, is increasing their salaries. We need to ensure that these health workers have reasonable accommodation, they have supplies and equipment to work with, and they also have supervision, and they also have continuing education.
Mwebale kujja oli mulungi abeeka mubalese batya ye bali balungi abaana baffe Lovinza oli otya akatabo kaffe kayina Lovinza jangu tugende.
The government of Uganda has tried to address recruitment and motivation of health workers, but what has been done is not enough. We need to ask the government to put more efforts into recruiting more health workers and motivating them.
Matano is one of the priority areas of our implementation programs, and it is one of the priority area for the national programs as well. And we are providing maternal service in all our facilities across the district. Maternal health has been a problem, and we have noted some issues concerning it, especially when you look at the mobility of our mothers who try to access this service and who live in rural areas actually, where they get problems to get in touch with us at the where we are providing this service. But as the government went on to recruit some additional staff, this one ideally came at a time when we needed this support. The support included recruitment of doctors, midwives, and other cadres who are directly in support of providing maternal health services.
Much as they've recruited recently new health workers, still there is a deficit of health workers because the population is growing every day. And this structure, which they have not even yet fulfilled to 100%, was determined a number of years ago and was still attending. It was determined according to the population of those days.
We want to encourage the government to meet its commitment of employing the number it said it would recruit, but we also want them to make sure that these staff who have been recruited are motivated.
Some of our people have resigned from the government because of bad conditions we are working in. Because you can't look at the mother dying when you know what to do and you don't have the equipment and the materials to use. It is very difficult for us midwives because you also feel bad when you're sending that mother to the hospital. I would like the government to help us, at least give us some small vehicles which can manage to transfer the mothers to those hospitals, because those problems, we face them and we can't avoid them.
Obuzibu nasanga ku lubuto lwasooka ng'asumulukuka nti yalumwa kiro nnyo awataali ntambula, nekyali kya mukisa mulungi twalina abasawo abatuli okumpi mu kitundu we tuli nga batulagira mu ddwaliro okuba n'ebikozesebwa byonna byaliwo. Kirabika n'okuba ng'era yatuuka akooye awataali oxygen kuba bwali bwa kiro nga tulina ngeri gye tusobola muddusaamu, tetulina ntambula, yatuuka akooye.
When the baby is tired, the baby is aspirated. There is no machine which can help the baby to suck the aspiration out. We don't have the oxygen. Sometimes the baby needs oxygen. So that means we have to transfer that baby to Mityana, but the process of transferring the baby can die from the way.
Newankubadde nga mbeera yatugwako bwetyo kituufu abasawo bo bayinza okuba bakolera mu mbeera mbi kuba singa oba olina ssente nga katugeze olina omutwalo ng'ate kuliko eyakusooseewo so gumuwa n'asooka ggwe ate nga ali eyakusooseewo akyatudde kitegeeza nti n'omusaala gwabwe mutono nnyo baba bali after money. Government kyendandisabye nti yandibongedde ku musaala ate nabo nebongezaako n'abeeramu obungi.
The money we get is very little. So we would like to ask the government at least to look into that, because every day and night, cost of living is becoming high. So that is bringing also the downfall of our work, because you may be here thinking of what you are going to eat, where you are going to buy the food you are going to eat, the transport you are going to use going there and coming back. You look at your child is in school, they need school fees, your parents need help. That is very little money we get. So we would like the government to help us and look into that.
Let them make sure every health worker is paid. Currently, there are health workers who are not on the payroll. They are recruited, they are not paid. They are there.
Emityana abasawo bakugula buguzi. Era baba tolina ssente. Babagula ne tuwulira nga nakyo tukikooye. Abalwadde balina bangi, ate abasawo balabika batini. N'omusaala gulabika nga si gwa mulembe. Babawa.
As far as the health workers are concerned, not only in CHAMCC, but other health facilities, health workers are not staying there because of accommodation. You find that a health unit, health center 3, which is a sub-county health center, there is no accommodation. How will the health worker work? Is moving 10 miles from your home to come and work. Automatically, this person has to reach rate at a workplace. And the patient will be suffering, sitting for long hours, waiting for the health worker to be served, which is a very big challenge. So, we ask those people who have the authority to help us and at least avail accommodation in health facilities so that the health worker can stay around, and this will lead to improvement of our health services in our health units.
For motivating staff is their well-being when they are providing this service. One is accommodation. If someone has got good accommodation at low placement, I think it can be a bit comfortable to stay.
The condition of the houses we sleep in are very poor, because we have one house, we share it like 4 people. One sleeps in front, one sleeps behind, but the structure is very poor. The verandas are falling down every day. When you step on it, you can fall with it. No privacy. We don't have toilets. We use the same toilet like with the patients. In fact, we don't have even bathrooms, because we have only one bathroom, which we use all of us who sleeps here. We have 4 people sleeping around. I will beg the government to help us to come up and construct at least good houses for health workers.
When a health worker has a reasonable accommodation with lighting, with water, it encourages the health worker to give the best services she can provide. Our addressing maternal and newborn health has been very slow. We are not likely to achieve our target for the MDG 5 by 2015 unless we make a special effort to move faster than we are moving at the moment.
This is the cry for mothers. Yeah. Let us stand together as one for mothers. Yeah. Let us fight together as one for children. Yeah. Let us stand together as one for mothers. Every mother deserves to live, my friend. All the children deserve to live, my friend. Let them see the joy of life. Let them